Are you an easy BBL or are you a difficult BBL? Well, if you're curious to find out what's the difference, then watch my video. Hi, it's Dr. William. Here I've got two patients. This is her before, this is her after, and then this is her before and this is her after. So let's start with the patient that is an easier patient because she's already has a very good shape to begin with. Here she is beforehand. She has a nice shape. She has a good waist, but she does have quite a bit of heaviness in this key area. When I do her marking, if this was sort of in real life, the key area is this little area that's in here. And so by removing this key area here and getting rid of this, we're able to transition from the concave part of the OG, and that starts to transition into the convex part. And so she has a nice pretty OG shape. She's got a nice small waist and she has nice volume to her butt. I usually will fill people up here to be able to get a nice hip. But what I'm really looking at is this line here. And I want to know where am I going to take this, because when I'm filling this in here, what I'm actually paying attention to is this line, because you'll see how she's straight here and afterwards she is more round. Now, can she be more exaggerated if she wanted? I guess theoretically she could, but there's also a limit when you put fat in as to how much will come out. Okay, so that you know, we have a nice shape and we're happy and things are good. There's actually a lot of asymmetries that I could point out to you about her that you'd be like, oh, I didn't realize that, because they're normal asymmetries. Here's one, for example. She has a little bit more fat here than she does on this side. And so even if you look at her afterwards, you'll see she has a little bit more fat here than she does on this side. That's normal asymmetry. If you look at her overall shape, it's still beautiful, it's still the OG, but there's a little asymmetry that's there. So that's kind of what I would say an easier BBL. Here's an example of a more difficult BBL. Well, what makes her BBL difficult and this patient is not difficult? There's a few things. So number one, her overall shape is more in a V kind of shape to begin with. And we really want the opposite. We want more of something that's like this. So she's starting out with a difficult shape. She also has what's called a negative vector. So if we look at her from the side, instead of her butt sort of coming out, you look at her from side and she's more sort of in to begin with. So her vector is negative. Then she also has something that's more challenging. She's a little bit tighter here. And so if I just kind of dot where her butt is, like this is very tight areas and they're difficult to fill. The other thing that she has, obviously she's got some fairly significant dents here. Look at, she's got asymmetry as well. Look at how she's got more fat here than she does here. That's normal. When I do her BBL, it's the same principles. We're still gonna lipo through the key area where we're gonna be getting the fat out of here, and that's gonna help to round her when we lipo through the key area. If I don't lipo through the key area, then instead of being round here, she's gonna be more square. If I just lipo through here, then her butt would still be kind of square and very long. So that's why we have to go through the key area to round it. She's naturally a little straighter. She doesn't have a naturally small waist like this patient does. So this patient, when she has a small waist and we lipo, we get a very small waist. Here, she has a smaller waist, but we're not really able to get this OG to be as concave as we want it to be, because even after you remove all of the fat, her underlying rib structure and her spine is more square here. So that's why she doesn't have as much of a concave line as this patient has a really concave line, and that's just because of her natural underlying waist. She still has a nice result here and she's happy, but if she had a naturally smaller waist and removing the fat, you would have seen a little bit more concaveness here. These dimples are always very tricky. and you can see that I was able to correct them, but not 100% correction. And that's what I usually tell patients that have dents or dimples, or they may have had an injection of steroid or injection of antibiotic in their past, and they can develop these deep and they don't like them and they want them fixed. I usually say, well, they're going to be better, but they're not going to be completely fixed. And you can see that. You can see that she has a little remnant of that here, and she has a little bit of a remnant of that here. It's much better. At this point, she's having a hard time wearing clothes. At this point, it's really not a big deal. It's still there. It's not 100% corrected, maybe, I don't know, 85% corrected, 90% corrected, but that also makes it challenging. It's tight in this area. So what I really would like is I was able to blend this in better here, but I would really like a little bit more, but it's just the tissue is not forgiving here. And particularly on this side, you'll see that she still has a remnant of that tightness in that area. She also has something called chicken butt, which I didn't name it, and people do laugh about it. Somebody said WTF is chicken butt the other day, and I was laughing because it's a funny name. But she has a mild chicken butt. What you'll see is it's typically a horizontal line here, and so that crease is very flat. It's usually short. It usually doesn't go all the way out. Like if you look at her crease is a little bit longer, and you can see her crease is a little bit rounder. It's not flat. And we can't change what that natural crease is. We can't fix that. We can improve it, but we can't fix it. But if you look here, when she started, she didn't have any of that. She had a nice round crease here. And not everyone's crease goes all the way. So there's always a variability in this distance, but she has a very nice crease. Here, this crease is straighter. This is with chicken butt. And then the other thing you see with chicken butt is you see this little notching right in that area. You see that little notch right there. And you can see afterwards that I was able to get fairly good correction here. I'm pretty happy with this. I can't change the flatness here. That's going to always be there. But what you can do with chicken butt, if you don't recognize it preoperatively, is you can make it worse. Because if you inject fat in these areas, it'll cause these to hang more, and you end up with that kind of look. And she doesn't have that because I didn't put any fat here in these areas. Where I'm putting fat is in the notch. And this is actually where ultrasound is really, really helpful, because when I get into that area, I want to maximally expand that notch, and that notch is tight. But I can use the ultrasound when I'm injecting the fat, and I can hold the ultrasound up top and I can see, so I can get all of the fat in there. I can see where I've placed fat and where I can place more fat. And so I'm happy about this. I would say this is probably 100% correction of this area, because when I look at her here, I wouldn't necessarily think that she started out with chicken butt. But if I look at her preoperative photo, I'm like, oh yeah, she did have chicken butt. But it's because I didn't inject any fat here, so we're not going to get that little extra droop here, which is really hard to fix. These two areas here, this now looks smoother, and you don't see as much notching. But when you fill this notch, you actually have to fill it all the way up. It's kind of like the hip dip. When you start with the hip dip and you want to fill that in, you actually have to backfill. It's the same thing. Like, look at this hip dip here. I have to backfill and fill that in. The notch is kind of the same thing. You've got to backfill in here so that you get a smoother transition between this area. This is why you can't really just lie to a patient like, oh, you're gonna look so great and do all this stuff, because I have to then look at this patient later and sit down and talk to them. This is all about expectations. So with this patient here, I don't really have to say too much. There's really nothing kind of difficulty that I'm going to anticipate. I may point out to her, like, you have a little bit more fat here, you're gonna have a little bit of minor asymmetry here, but in general, I'm gonna do the OG and she's gonna get a nice shape. But when somebody has more challenging problems with that negative vector, with that V shape, with the dents, with the chicken butt, with very tight tissue in these areas. Those patients have to understand you're going to have a nicer shape, things are going to be better, but there are some limitations. So I like to try to point out things that can be improved and can be made better, but that if this patient has this view in mind preoperatively, she'll be disappointed. If this patient says, okay, I understand some of the challenges that I have with my preoperative shape, and I understand you're going to try to correct them and do the best and still try to get the OG, then they're going to be happy what she is, because she has realistic expectations. So whenever I do a consultation for anything, if it's a breast reduction or if it's a breast lift or whatever it is, I'm always trying to frame the expectations correctly. And so we have a very honest discussion, and patients will look in the mirror and we kind of point these things out. And I try to say them in a diplomatic way, but I also want to say it in a very obvious way so the patients are very clear and they understand what they're getting into. Most of the time, if I have a patient, let's say somebody had surgery with doctor or whatever, and they come to see me, most of the time the patients will say, I'll say, oh, what are you unhappy with? Well, I was expecting. And so what happened is, it's not necessarily that they were botched or had a bad surgery, it's just that their expectation differed than what their result could be. And so it's very important when you sit down with your surgeon to go through and point out things, and to have them point out things. Okay, well, what's something not good maybe? You don't have to tell me that, because I'm happy to tell you. I'm happy to tell you, no problem at all, because honesty and transparency leads to a better satisfied patient, even if there are limitations where we can't fully reach their ideal goal.